Dr. Saleh, thank you so much for joining me for this conversation.
Yeah, thank you so much.
Dr. Saleh, you know, you have been talking about technology, you've been talking about how technology can be imbibed in the healthcare system and how it can impact the quality. What do you think are the kind of technologies that have transformed the healthcare system in the last maybe a decade?
Yeah, if you ask this question, I'll go back to almost 4 decades before I started my career as a medical person after completing my undergraduate and postgraduate degrees, and how the evaluation of the medical this thing growth has happened in the technological growth in the medical uh, profession. That just I'll brief you. When we started 40 years before, even including the drugs or the equipments what we were using, they are almost outdated.
Correct.
The lot of research is happening and it is going to happen in coming future also. uh, to say the few example, being a anesthetist, we were using the crude machines those days to induce the anesthesia. Before that there were no high end machines also, 40 50 years before. And today if you ask me, everything is computerized. And the recent generation last few years which is coming is with AI generated anesthesia station. This is as far as my specialty is concerned. Now if you go in the multi-speciality, in different specialties, whatever you take any equipment, whether it is a CT scan, it is a MRI, it's any other diagnostic machine or any other laboratory diagnostic machines, everything is automated now. Everything is with AI technology. In the recent generation is coming. Everything now you with the mobile advancements and the lot of gadgets which are coming in the market. See, even though you are traveling, everything you can get connected with your patients and you can make what is happening with your patients, and everything can be connected to your mobile and you can just find out what are the ECG changes, what is happening, what was there in the morning, what is there in the evening, what changes I have to give to my junior doctor so that they can implement and they can revert that after this so and so change in the management, things have become changed. See, everything can be monitored.
Absolutely.
And
And
not even sitting at out of the country also you can make out.
absolutely, absolutely. You know, we have seen that hospitals in the metropolitan areas are serving not just that particular city, but also the neighboring areas, right?
Right, absolutely.
And now with technology coming in, like you said that today you are able to monitor from a distant place, right? How has this impacted the continual care when people leave the hospital after getting the initial treatment, surgery, etc.? And do you think it has changed the patient doctor connect to be more meaningful, create that sense of belongingness to the institution? And is this impacting overseas patients who are coming to India?
Exactly. Now the things are getting changed slowly, slowly. In the sense, earlier we used to keep the patient after any surgery 6 days, 7 days, and then we used to remove the sutures and then send them home. Now we are sending the patients on third day or second day or in daycare also. So I mean, depending upon the surgery maximum, and the era is changed. Now most of the surgeries are done laparoscopically, or we call it as a minimal invasive surgery.
Correct.
And now the era has come last few years, it's the robotic assisted
Robotic surgery.
surgeries. And the change, I can visualize, I can see, I can witness that change. For example, I'll just want to quote you the see total joint replacement surgery, TKR surgery. When we started doing it long ago, that time everything was manual. See, human errors used to be going micromillimeters here and there. But now with the robotic assisted surgery, the diamond it automatically stops. If this computer screen is giving this much, there it automatically stops.
So has it
So
reduced the
hairline,
errors?
It's hairline. So whatever cuts are going to be there, it is a hairline when joint replacement. Because it doesn't go, if it is saying this is the line, that line it goes and stops.
Right.
So that is the beauty.
So
But when you are doing it manually, there might be some hand movements or something like that
correct.
here and there. There are chances.
Correct.
But there you can't. So that is the advancement of the technology. That's number one. Because of that, you can discharge the patient early. There is no blood loss. Earlier, without every surgery, unless until blood is there, we never used to post. Now, blood is hardly required for
Right.
such surgery.
Right.
There is another. As you are discharging the patients early, everybody is giving, this is my WhatsApp number, if anything is there, you contact. This is my emergency department, where if anything is required, you contact this. Besides that, if something is required, see, these are the local people where you can contact, they can contact. It has become so easy that communication has increased. Now patients also, they just go on doing a video call and show that this thing is okay, I'm fine, this thing, they can talk to the doctors. This is how.
It's you brought in a very important aspect, sir. When you're looking at technology, I'm now taking you away from your clinician role. Now let's go to the administrative role. When you are, just imagine you're not a doctor, you're managing the hospital, which you are. You have to look at things beyond the clinician level. You
Right.
have to look at compliance, etc.
Right.
Now, one of the things that doctors have been, and in fact, every healthcare provider is using almost on every minute basis, is a technology like WhatsApp, right?
Yeah.
Whether it is communication with the patient or their family, or with fellow doctors, or with laboratory work, etc. And suddenly the government comes up with DPTP laws, DPTP rules,
Yeah.
and suddenly the personal data privacy has become a very, very big issue.
Yeah.
Now, if you go by what the rules define, I think doctors can't function.
Yeah, that's
Right?
true to some
So,
extent. Today,
so,
I heard that
so
lecture.
how do you balance technology use by ensuring you do not cross the line, not just for data, this is just one example, but data privacy or data used across the system, is you are at the edge. So how do you balance it? How do you take that?
See, always for anything which is a new thing coming, unless until it gets totally inculcated, there are pros and cons also. Unless until all the professionals in our fraternity, they go and train themselves thoroughly. What is this exactly? And what are my limitations? How much I can use this technology? Finally, see, even though any technology, whatever is coming, ultimately the specialist or the expert of that fraternity is required to operate that.
Correct.
And to talk about the safety in this, unless until you are with the thorough knowledge, each and every aspect. So continuous medical education when we talk, and these things are coming mandatory now in our field, that every conferences or any conclaves we talk on these subjects, and this is how continuously learning process starts happening. Somebody learns, they take the care of the others to teach them, and this is how spread is happening.
सर एक चीज़ बताना मेरे को, I mean this is something and I'm asking you because you are a clinician yourself,
Yeah.
and now you also are an administrator.
Right, right.
And pardon me for saying, doctors sometimes are very egoist.
Absolutely.
Right.
They are hard nuts to crack.
So when when an administrator says that, listen, be careful when you do this, the probable response used to be, I don't know if it's changing, was यार किसी और से करा लो फिर ये काम, मेरे से नहीं होता ये सब चीजें.
Absolutely true. This
Right?
happens because, say, for example, I am practicing for 40 years the same thing. If somebody comes and tells me you go do like this, at first instant, I never ever listen to them. I say for your computer typing falana falana, it takes lot of time.
Yes.
I can write the prescription within a minute's time. You will take 5 minutes. But
Correct.
now slowly things are changing. I'll give my hospital example. We had a resistance for the OPD EMR earlier, but now almost 100% everybody, all senior, those who are practicing 40 years plus, they are doing OPD EMR on this thing.
EMRs.
This,
So,
but it took almost 2 years time to complete that.
so
This
now when you're looking at a hospital, one is a large hospital, 200, 300 beds and above. There, the compliances are possible because there are large teams that are there. The challenge, in my opinion, is the smaller hospitals, which are family run hospitals. They do not have that much of professional leadership that is there, and where they're not very conscious about bringing that change unless they're forced to. How can we build a culture of building resilience and adopting the change that the technology and the compliance requires for us to make?
exactly. See, the smaller setups, this problem is there,
Correct.
and there is again, as I said, generation gap is there. Newer generation, new people coming and starting, they are starting with the all newer
Fresh stuff.
fresh. But the old people, there is always a problem unless and until uh, not everyone. There are few people who have adopted the newer technology. Again, if you ask me, there are segments: pretty senior people, middle segment people, and the large junior people.
Correct.
Junior, they go with the newer these things, everything. Middle stage segment people, they are adapting slowly, and they are becoming in the same lane. Senior people, there is a problem. They are, because they are not much of the computer savvy, and they have practiced for many years with their own, and they have. But people now, they have realized. I have witnessed some of the people who are practicing 50 years, but now they are practicing with AI assisted practices. They have started doing it, and rather they are promoting this. Now everyone has to go. Now, if you don't learn AI technology, which is getting incorporated in the medical field, you are nowhere.
So it's a survival.
Yeah,
It's
it's
a
survival.
survival today.
Now, even in the lecture also, today's lecture, it was quoted, if in radiology, if you don't learn the AI technology and don't use it, you will be thrown out of the system.
Correct.
This
Correct.
is what,
So I
this
think
is the future.
one thing good that has happened is that because of these conferences and these conversations and interviews that we have done, we are seeing that people are becoming more resilient to change.
Yeah.
They are adapting it more proactively, and uh, the change, people are realizing that the acceptance is inevitable, whether
Yeah.
you do it willingly or whether forcefully, but you have to change.
Yeah.
uh, what is that, with people who have rich experience like yours, who have transitioned from traditional practice, as we call today, to imbibing technology, then automation, and today AI, and we don't know what's going to be happening tomorrow. What are these 2 or 3 leadership learnings that you have that you'd like to share with the new leaders who are emerging today? क्या 2-3 चीज़ें हैं जो आपको लगता है कि ये चीज़ तो बेटा मान के चलो कि होंगी, and this is how you need to.
One thing, learning from the book is a different. Learning comes with the experience. That's one thing. And experience comes with understanding of the culture which is required in the healthcare industry. To create the culture, it requires a lot of efforts in the administration, and that's how you have to lead the leadership.
Fantastic. And sir, my last question to you, sir. How do you deal with the questioning around ethics of a hospital and doctors today? I keep saying this, I keep repeating my question every time with people I speak with,
Yeah.
that there was a time when you started your practice, doctors were
Uh,
treated like gods,
yeah.
and today people who come to the hospital come with suspicion.
Sometimes I know because I started exactly my career in 1980. Almost it is I have surpassed 45 years, and I have started my career in absolute rural area to the most urban area like Bombay, and now relocated to Pune last 30 years before. But having said this, it is sometimes frustrating when I come across there are some malpractices in today also in the session they were showing some of the slides that this is how they are doing, this is how they are doing, and that's why there is a conflict. This is disgusting, and actually it is intolerable. But it is not even 1% of the population, but that gives a bad stigma to our whole fraternity. People should not do that.
तो सर कहाँ पे हमने गलती करी? Where did we go wrong? From 1980s when you started the practice to
Gal-
today, what mistake did we make? I mean, is it the why we have learned a lot from the Western world, but we also got in the corporate healthcare
what our
practice?
teachers told us in during our this thing curriculum, that you do whatever you are doing with work honesty as a patient, as a your this thing of, because you are going to run your this thing everything whatever patient is going to pay, you should not be behind the money. Money will automatically come behind you. Now the things are little bit getting changed. It is sort of when it is labeled as a healthcare industry, then all the industry norms are getting applicable. That's how it is getting changed. Now everybody is looking healthcare services in a different model. Earlier it was a different model. It was just a profession. Now who is bothered about the profession and all? That is the basic difference, change in the.
So I was having a conversation with someone else today, and we brought out the same thing, that it's now an industry, and we were talking about that we need to look at patient experience, patient delight. Now, if we are trying to make patient happy, taking care of beyond what the basics are, then we are looking at customer service experience,
Yeah,
right?
customer service, now we call it as a patient's actual experience.
Correct, correct.
Okay, with that context, that is what I said, a culture.
Huh.
When your organization has got that culture, the patient will go with the high satisfaction index.
No, but there is a challenge also, sir.
There is a challenge.
The when you're looking at this, then there are other aspects of industry. Like you said, if you treat it like an industry, then everything comes into play. Then people are going to courts, right? People are not very in acceptance of the errors. Jabki errors is very very important to report, but when you report an error, then you are sacrificing your career and
Absolutely, you are
patient
right.
violence, etc.
Yeah, absolutely, you are right. In spite of this, so a lot of accreditation processes are there, SOPs are there in place. Each and every organization is highly focused on the patient satisfaction index in healthcare industry, and they are managing for that. That's how these type of conclaves, conferences, everything is happen, and it is continuously taught to the staff that this is the way
So it has been
healthcare industry runs.
grained
And
into your mind,
yeah, yeah,
right?
that is.
How, sorry, I'm asking you one more question. This is the last one. How do conferences like AHPI or other conferences create that impact? How do you think AHPI conclave, global conclave, is actually contributing to making healthcare delivery better in the hospitals in
Yeah.
India?
One is this thing of conference or conclave, what we gather together and discuss some of the things. Otherwise, also every month we meet on virtually, and we discuss certain issues and whatever issues are there. And our focus is, if you see the whole day, the focus is somewhere. Patient is at the center, and totally it is rotating around the patient only. That is the basic thing. So, irrespective of anything, patient service, everybody gathered, everybody will talk on the patients, how our better service can be given, what is the technology, how better. And every day it is going to change and we have to acclimatize with that and get trained.
Fantastic. So I think one difference that I see the organization or the conference makes is to keep reminding you
Yeah.
that don't get distracted. At the end, center of it is the patient. So technology, services, quality,
All the
everything has to
technology.
be focused on
Say
that.
for example, there are even 10, 15, 20 company people are. But for everything, there are lakhs of people who are there, associated stakeholders, you can say, for the patient's care. But our client is the basic and that's the patient for us.
Fantastic.
That's the basic.